Hello, everybody. I'm Dr. Castelblanco, one of the pediatricians at Facey Mission Hills, and this is Dr. Ruth Sapanian, one of the pediatricians in the Copper Hill office.
Hello, everyone.
So thank you for joining us today. Today we have a very relevant topic that we're going to talk about briefly. We're going to talk about back to school. So going back to school and some common questions that come up when we send our kids back to school in the fall. But of course, this is all relevant for all year long. And as we typically say at the beginning of each of these Q&A sessions, this is not meant to be all-inclusive information, everything you need to know about these topics, but just some information to help you out. But if you have further questions or if you're not sure what is right for your child, you're not sure if your child should be seen, the best person to ask is your pediatrician. So we encourage you to call your pediatrician if you have any questions about these topics.
Absolutely.
All right, perfect. So our first question we have is, what do I do if my child has a hard time focusing or concentrating in school? Dr. Sapanian, would you like to address this one?
Absolutely. Thank you. So we get this question a lot, and sometimes it comes from the parents and sometimes it comes from the teachers noticing some concerns with the child's ability to either stay focused or even sometimes stay in their seat, or sometimes they run into trouble because they talk to too many of the kids around them. So if these are some things that you're noticing or worried about, definitely the first place to start, I would say, would be to get as much feedback from the teacher as possible, get as much information as possible, and of course, talk to your doctor as well. Usually some of the things I'm always curious about is to know if this is something new. Like if your child is in second grade and they've been struggling since kindergarten, it always helps to get that feedback from every teacher to kind of know what everyone's impressions are. And then also to get any feedback, like if there's like an after school program, like maybe your kid's in basketball, or maybe there's a Sunday school program, anybody who interacts with your child, get some feedback from them. And of course, you can also use your observations when you're with your child as well, like during the weekend or after school. If you do notice there really is indeed a concern in terms of staying on track and focusing and attention, I would say there are a few things that we always want to address. So first and foremost is making sure that your child is getting enough sleep. Of course, as all of us know, if we've had sleepless nights and we haven't slept well, the following day is rough. I mean, it's rough for everyone to be able to focus. It's hard for anybody to be able to really bring forth their best, especially in the academic setting. So ideally, of course, for older children, we're always looking for more closer to like 8 to 9 hours of sleep. So that'll be something we'll continue to talk about a little bit more, but always make sure that your child is getting enough sleep. The second thing is making sure your child's eating 3 meals a day. Some kids, they skip breakfast, unfortunately, and then for their first period and second period, they are not quite as focused until they maybe get a snack in and then they feel better. So if you can, try to make sure your child's eating breakfast, lunch, dinner, and then perhaps some snacks in between to help them maintain their focus. In terms of the meals, I think that's also an important area to focus on. Some kids we see they love to grab a bag of chips and run out the door, and that's their breakfast and lunch, and sometimes snacks, and they don't really eat a well-balanced meal. So I would say let's make sure we're getting a good amount of protein, fruits, veggies, getting the full balanced meal to hopefully make sure that we have all the nutrients that we need to be able to focus. And then, of course, if we're still noticing, all these areas are being addressed, you're getting enough sleep, you're eating well, and there's still a concern for focus, then I would say we should definitely reach out for more help. Of course, our pediatrician is always available to help out. We would always love to hear from you. If, of course, any concerns come up, please don't hesitate to reach out. Some of the things I tell my patients is, let's also talk to the school. Let's see if maybe we can get the school on board. Some kids, they struggle with, of course, if there's like a classmate that they're really good friends with, they might struggle if they sit next to that person. They might just want to chat more and not focus as much. So the school might be able to help us out with providing a more individualized plan to help us, and also to identify if any learning issues that need to be addressed. So I would definitely encourage parents to reach out to the school to see if there's anything they could do through the help of an assessment, usually an individualized educational plan. They're able to identify any areas of concern and provide more support for that. Um, and then the other area that we try to address is through mental health. Sometimes we just need a little bit of extra help in redirecting our thoughts and being able to redirect our mind to be able to focus on the task in hand. Of course, we usually develop this as we get older. I think a lot of people, they tend to do well as they get older, but when we're kids, it's really hard sometimes to be able to redirect our thoughts. And thankfully, with the help of behavioral therapy, we're able to see this happen much sooner. And a lot of kids are able to have really good outcomes with the help of a therapist. So, you know, that's a direct service to you as the parent. So don't hesitate to call the insurance, ask for any of the therapists in network. They usually give you a list. You can contact them, see who is available for children, and schedule an appointment to have behavioral therapy to help with redirecting their focus. Um, and then, of course, we're always here. Some of our patients sometimes might benefit from the help of medications. Some of them do well without. Some of them might just need a little bit of adjustment in the classroom setting. There's so many different areas that we can help address, but these are some areas that I usually start with. And of course, we're always here for you, so don't hesitate to reach out and let us know. Any thoughts, Dr. Castablanco?
Yes. So I agree with all of that, Dr. Sapanian. Thank you. That was a very nice summary of things to look for if your child is having difficulty concentrating. So Dr. Sapanian touched on something very important, getting enough sleep. So how do I make sure my child gets enough sleep is another question that we definitely get. So it is recommended that children get about 8 to 10 hours of sleep. And I realize that especially in high school, sometimes that's almost impossible with all the after school activities and homework. But to try to at least get those 8 hours of sleep would be really great for kids. It helps with focusing. It just helps you feel better. You have more energy throughout the day. So a few recommendations that I have, and these are all related to sleep hygiene. You should try and go to bed at a reasonable time so that you're in bed for that number of hours, for 8 to 10 hours. The hour before bedtime should be an hour that is relaxing. Hopefully not an hour where you're going to be doing exercise. That hour is not the hour to be snacking or having dinner. No screen time, at least an hour or two prior to bedtime, and that includes cell phones, tablets, computer, television, because the blue light from those electronic devices sticks with us and does not let our body rest and doesn't let us go to sleep at an appropriate time. And maybe your kid is staying awake, staring at the ceiling, not being able to rest. Or some teenagers take their cell phone into the bedroom and even in bed are scrolling through social media or texting with friends. So really trying to remove those electronics. If your child is very addicted to being on their phone all the time, it might be a good idea to have some sort of rule where an hour before bedtime, all electronics go in a separate room in a separate area so that everyone in the family can get a break from that. By doing something relaxing the hour before bed, you are getting your body ready to relax and sleep. So listening to some music, sometimes just drinking a little bit of warm tea, although I don't recommend too many liquids right before bed because then that often causes us to have to get up in the middle of the night and use the bathroom, and that is disruptive to our sleep. So not a lot of liquids right before bedtime. And then in the morning, have some sort of alarm to get up. The teenage body in particular naturally wants to go to bed a little later and wake up a little later. Unfortunately, schools start on the early side. So it may be a little bit more difficult for your teenagers to get up in the morning and go to bed at a reasonable time, but really trying to do that relaxing hour before bedtime, getting them in bed at a good time is very important. No late night snacks, I mentioned. Right before bed, it can affect your blood sugar levels and make you not feel so great in the morning when you wake up. So dinner should be at least a few hours before bedtime so your body has a chance to digest before you go to sleep. Some people ask about, medications for sleep. I would encourage you to talk to your doctor about that. We typically don't encourage, for normal children, we don't encourage medications to go to sleep. We would really like you to try all those sleep hygiene tips to try and get them to go to sleep in a more natural way. One last thing I'll mention that is helpful is getting some exercise during the day. Not right before bed, but earlier in the day, especially on the weekends, Saturday and Sunday. You guys have a little bit more time those days because there's no school. So try and get in some exercise so that your body is nice and healthy and that you feel like you can go to sleep in the evening. Anything to add, Dr. Sapanian?
Yes. So there's one more thing. Some kids I've noticed they get enough sleep. They sleep like a good 8 to 9 hours, but it's really hard to wake up in the morning. They're really groggy, they're really tired, they're sleepy. And in this case, I would encourage parents to monitor their child when they're sleeping. Go in a few times and check in on them. Is there really loud snoring? Is there a lot of thrashing and moving in bed? Because some kids, they might get the adequate number of sleep hours, but they might not have the most restful sleep. So those would be areas that I would continue to monitor. And if you do notice any issues also during the sleep, whether it's significant loud snoring nightly, or if they are falling asleep on short car rides, or if they're really sleepy despite enough adequate hours of sleep, please do reach out and talk to your doctor as well, as those might be areas we might need to further assist with. But thank you. Yeah.
Absolutely. That was a great addition, Dr. Sapanian. Perfect. So we're moving on to our next series of questions. We're going to talk about like injuries that your kids can sustain while they're at school. So one of the questions is, how can I take care of common playground injuries and when should I be worried? So these are things like bumps and bruises, scrapes. So if your child is on the playground and they fall off the monkey bars, what do we do? How do we know it's something serious or something that you can take care of at home? So the first thing you should assess when there is any kind of injury is how much pain they're in. Is there a wound that's bleeding? Is there significant bruising or swelling around the area? And can they move that part of their body that was just injured? So this is not going to be an extensive list of all the possible injuries, but just kind of in general. So the things that are mostly injured are limbs, right? Hands, feet, arms, legs. The kids will fall and scrape their knees. So if it's just a superficial injury, you can just do some basic wound care at home. Keep the wound clean. First thing you should do is wash it with some clean water. If it's bleeding, hold some pressure over the wound to stop the bleeding. You can use a topical antibacterial ointment. Neosporin is a popular one. If it looks like it's a large area, to try and prevent it from getting infected, and then keep it covered so that it doesn't continue to be exposed to clothing and the sandbox and the sun. And then just change the bandage on a daily basis until it heals. Most superficial wounds heal very well. And then after they heal, if it is a big enough scrape, a big enough wound, you'll want to keep that area out of the sun if you can, to try and prevent the scar, if there is going to be a scar, from being more prominent. And then I would apply sunscreen once it's healed, sunscreen to that area every time you're in the sun, again, to try and prevent the appearance of the scar. And that's really just a cosmetic issue there. But then what if you have a bigger wound? So if it's a bigger wound that has actually cut into the skin, it may be that needs to be sewed closed, that we need to put some stitches or some staples in that. If it's unclear to you, then that's a sign that you need to bring your child in, either to the urgent care or the emergency room, and have a doctor clean the wound if it looks like a deeper wound, and then see if it's necessary to stitch that closed. And you'll want to do that pretty soon after the injury. If it is an injury where you think that there may be a broken bone, anytime you think there might be a fracture, a broken bone, then also you'll want to take your child in as soon as you can, so that that extremity or that part of the body can be immobilized. So what we can do is we can put a little splint on that area so that your child doesn't move it around. They may need an x-ray of that area to confirm whether it's a fracture or not. Typically, if they are not able to move it, if it's too painful, if it's very bruised and swollen in that particular area, then those are signs where we have a higher suspicion for a fracture, and will likely order an x-ray to confirm. So if that's ever a question, bring them on in. We will let you know if it's a fracture or not. Most injuries, though, are sprains, and like a wrist sprain or an ankle sprain or a knee sprain, and those can be very painful too. So you bring them in for that as well. But hopefully it's not a fracture, and hopefully it's just a sprain, but we'll be able to tell you in the office which one is more likely. Um, Anything to add, Dr. Sapanian?
Yes, absolutely. So I agree with everything you said. The one area I would add is, of course, if you're noticing like there's a wound in an area, one of the things I encourage to prevent scarring, like you mentioned, is avoiding the sun as well as moisturizing. Sometimes, if we're able to moisturize the area, that helps with the healing process as well. Also, if you're applying Neosporin, it would help to make sure that you massage that into the area to help it from becoming more of a scar. The other things I would say is, of course, if there is an injury to a limb, like you were saying, one of the things, of course, we always like to do first is to apply ice to it. A lot of kids, they might just have a lot of pain initially. You put the ice pack on it, and all of a sudden they feel much, much better, and things are very different. So I encourage you to ice it. And of course, if you're on the way to see the doctor, or if you have an hour or two until you see the doctor and you're worried about a fracture, Oftentimes, we can also use either Tylenol or Motrin. Any other thoughts, Dr. Castabanco?
No, I think you covered that last bit. Thank you for adding that. Yeah, Tylenol and Motrin are really great for pain.
That's
So
right.
perfect. So moving on with a more severe kind of injury or a type of injury that we get worried about a little bit more. What do I do if my child has a head injury, and when do I need to go to the doctor?
Mm. Good question. So we tend to see this a lot, and I think this is a very broad question because there are so many age groups that would respond differently to a head injury. So first off, I know a lot of kids under 2 are probably not in school, but sometimes they're in daycare, and you can have head injuries occur. In this age group, if there is a head injury, I would recommend that you call your pediatrician's office and you have the baby or child seen right away, as sometimes it might be harder to pick up some of the subtle issues that might be noted in a younger infant. Now, if the child is older than 2, I would say if there's any kind of loss of consciousness, if there's vomiting, if there's changes in their mental status, or if they develop a severe headache, these would be all red flags that I would say the child needs to be either seen right away at the urgent care or the ER. These would be some of the red flags that I would watch for. Um, Now, if the child, let's say, is injured on the playground, has a head injury, a ball hits their head, and they seem to have some discomfort at the time, and then they're able to move and they're fine. Sometimes they might not have pain right away, and that might be a something we're usually thrilled to see that they're fine and they're going about their day, but I would still advise that they be monitored for about 4 hours just to make sure that there are no changes in their behavior, no changes in their ability to focus, and also monitor for headaches and vomiting. If you do notice any of these changes, of course, I would advise to have the child seen by either your primary care doctor or the urgent care or ER. Um, Depending on the severity of the symptoms, of course. Um, Now, some kids I've had with some of our athletes who are a little bit older, especially our football players or cheerleaders or different athletes. We've noticed that sometimes they have head injuries. Of course, their coach has them sit out, and afterwards, sometimes I've had some patients. They go home, they feel fine, and shortly thereafter, they go to sleep and wake up, and the following day, they might have a headache. So I would say again, if the headache, even though it doesn't present right away, if they present with a headache the following day, I would still be concerned for a possible concussion. And that's something I would advise that you definitely follow up with your primary care doctor. Um, Sometimes, of course, children might not always have a headache right off the bat, like we talked about. Some of the other symptoms that we might also want to watch for are going to be dizziness, lightheadedness, sort of confusion, a little bit harder time focusing. Some of them are more sensitive to light and sound. Some of them might have some nausea or upset stomach. So many different symptoms that might be involved after a head injury. So it's very important that after a head injury, we either have that initial evaluation, or if everything looks good, we monitor for 4 hours for any changes that might come up that might require an evaluation at that time. And then, of course, in terms of concussions, I would say these are areas, of course, after you've seen your doctor, we're always going to advise that you rest, avoid screens, avoid bright lights, avoid noise, and rest. Those would be areas that we want to make sure that we allow your brain to heal. It's more of like a bruise of the brain almost is how I describe concussions. And as with anything, we want to allow it to rest so we can heal. Um, and usually that could vary in terms of the process, but of course, we want you to follow up with your primary care doctor if there's ever a concern for a concussion. Um, any any other thoughts, Dr. Castablanco?
I think you covered most of it, Dr. Sapanian. And I would just add, just be honest with yourself and your coaches. If you're a teenager, parents of teenagers really look for those symptoms. Sometimes teenagers want to go back to playing their sports, and will not tell you that they're feeling dizzy or that they're having a little bit of a headache. So if it looks like they're a little bit off, it's just safer for them to sit out and not play. And if they're having continued symptoms after a head injury, like Dr. Sapanian was mentioning, following up with your doctor and formulating a plan with them on when it will be safe for your child to go back to playing sports. And most coaches these days are very understanding of these guidelines for return to play. So to talk to your doctor about it, and don't hesitate to ask us for a note for your coach, indicating that you probably should sit out for another little while.
Absolutely.
So
Yeah.
perfect. So our last question today is about nosebleeds. So I have lots of patients that come to me with nosebleeds. So how do I manage them or prevent them? And when should I worry? So nosebleeds are very, very common. I think especially out here, we live in the desert. It is very hot and dry, and that does tend to make things worse for people with allergies and people that get nosebleeds as well. Most nosebleeds are not serious. They are usually look scarier than they really are. You will see bright red blood coming out from their nose. It'll look like it's a lot of blood. But in general, most nosebleeds can be managed well at home. So if you get a nosebleed, I would encourage you to have your child, or you can hold some pressure on the nose. So just above the nostrils, just right up here, not down underneath the nostrils, because then you're just holding the blood in the nose and not actually applying pressure. But what we want to do is apply pressure up here above the nostrils, to stop the nose from bleeding. So the blood vessels that bleed are often little blood vessels in the nose that are a little bit beyond where we can see with our scopes in the office. So you want to hold pressure. I would hold pressure for at least 10 minutes until the bleeding stops. Do not have your child tilt their head back. They should be either sitting straight or leaning forward with a towel or tissue to catch the blood, but leaning backwards allows the blood to then be swallowed. Blood is very irritating to the stomach, and then sometimes you can have throwing up of the blood, and it'll look like they threw up blood, but really it's because they swallowed it from the nosebleed. So try not to tilt the head back. You can also put an ice pack over the nasal area. That also helps to shrink the vessels and stop the bleeding. Those are the main things to stop the bleeding. Try not to put tissue or cotton balls inside the nasal passage, because that is actually traumatizing to the tissues in the nose. And then once you pull them out, often the bleeding will start again. So most nosebleeds, very manageable. How to prevent them if your child has a history of getting nosebleeds quite frequently. At nighttime, what you can do is put a little glob of Vaseline right at the entrance of each nostril, and that will help to coat the nose so that when they lay down, that coats the inside of the nostrils and prevents that dryness. So you can do that every night if you need to, or just as needed if it's a time where they're having recurrent nosebleeds. The other thing you can do to moisturize the inside of the nose is use some saline nasal sprays. So just saltwater spray, not a prescription, no medicine, but just a spray in each nostril, maybe a couple times a day, in order to moisturize the inside of the nostrils. The last thing, which is also useful for moisturizing, is a humidifier. Putting a humidifier in the room, maybe at nighttime or maybe in the living room if you're going to spend a lot of time in the living room. But again, we live in such a dry environment that the air is typically very dry, and moisturizing the environment is helpful for our nasal passages. I often recommend a humidifier for people who have allergies or if you're having a head cold, but it's also useful for people who have nosebleeds. So when should I worry? I just said they're very common, but if the nosebleed is prolonged, so you think this is way too long, it's lasting for a very long time, and you're unable to stop the bleeding by holding pressure and doing some of those things that we talked about, then I would talk to your doctor about what they consider a prolonged nosebleed for your child. Some kids bleed for just a few seconds, some kids bleed for a few minutes, but we will ask you questions that will help us determine whether it is a nosebleed or nosebleeds that are outside of the normal. So things we consider are, is there a family history of bleeding disorders? And if that's the case, then maybe we're a little bit more concerned about your nosebleeds. Or was there trauma? Did you hit your nose? And in that case, we'll definitely want to take a look inside the nose, look to make sure that everything looks normal in there, that the nasal septum looks normal. Of course, you'll probably know if your child has some trauma to their nose, and if that's the only nosebleed they get, that was the reason. But most nosebleeds occur just spontaneously without any trauma, and also they can happen at nighttime while they're sleeping, and you'll find the blood on the pillow. So don't be surprised if that's something that happens. So if the nosebleeds are recurrent, let's say they're getting nosebleeds over and over and over again, it's just too many nosebleeds. If it seems to us, based on your history, that it is outside of the normal, then we may ask you some more questions, maybe do some more evaluations. Anything to add, Dr. Sapanian?
Two more things I wanted to add. So in terms of the humidifier, I completely agree. Everything you mentioned was right on. The humidifier, I get sometimes asked what kind, cool mist or warm mist. For this, I would go with a cool mist humidifier if they're like allergies and asthma. And then also for the saline nose spray, I've learned that sometimes the saline nose spray works really well for my patients in the morning as they're able to spray and irrigate out. And in the evenings, fortunately now we actually have saline gels that are able to sort of stay in the area a little bit longer and lubricate the nasal passages a little bit longer. They work really well in conjunction with your Vaseline or a little bit of the petroleum jelly you put on the nares. So those are just some other areas you might want to consider if possible. Otherwise, yeah, if anything persists or concerning or prolonged, please, please, please don't hesitate to follow up or let us know.
Awesome. And one more thing I'll add that I forgot to mention earlier about nosebleeds is that often little kids are picking their nose. And so if they tend to pick their nose, if you catch them with their finger up their nose, that can cause their nose to bleed more frequently because they are continually traumatizing the inside of their nose. So just keep an eye on that. If they are nose picking, try and keep their little fingers out of their nose. So I think with that, we've covered all of our back to school questions today. Again, this is not an exhaustive list of things that could come up while your kids are going back to school, but some of the topics that we thought were important to cover. If you have any questions about any of these topics, again, please reach out to your pediatrician. They are the best person to talk to. They know your child the best and can give you individualized care and recommendations. Thank you very much for joining us today, and hopefully you will have a safe and healthy school year.
Awesome. Thank you, everyone. Bye.